Almost everybody watching this has been told some version of the same thing since childhood. Eat your carrots, eat your fruit, get your vegetables in. Good for your heart, good for your skin, good for your eyes. And that is true. It is true enough that people make a very specific mistake at night. They stand in the kitchen after dinner, want something healthy, and reach for the exact fruit or vegetable that sounds responsible in their own head. A glass of orange juice, an orange, a bowl of tomato soup, a few slices of tomato with salt, leftover pasta with tomato sauce because at least it isn't cake. What almost nobody tells you is that for your eyes, the worst food before bed is often not the greasy, obvious thing. It is the healthy, acidic thing. Let me be careful with you right at the start because I do not do scare videos. Oranges are not bad for your eyes. Tomatoes are not bad for your eyes. In the daytime, in the right amount, in the right setting, both are perfectly good foods. Vitamin C matters, antioxidants matter, plant foods matter. The problem is not the food, the problem is the hour. And if that sounds too dramatic, stay with me for a minute, because the mechanism is a lot more interesting than the headline. Your eyes are not repaired in the produce aisle. They are repaired in the dark, during sleep, on the pillow. When your tear film stabilizes, your ocular surface rests, inflammation comes down, and the entire front window of the eye gets a chance to recover from screens, wind, air conditioning, dust, and all the blinking you forgot to do while staring at a phone all day. So if a food sabotages your sleep, triggers reflux when you lie down, or pushes you into the kind of light broken sleep that leaves you waking with burning, gritty, watery eyes, that food has just become an eye problem, even if it came out of the crisper drawer. I'm Dr. Naturis. I'm an internal medicine specialist, and one of the strangest little patterns you notice after enough years in clinic is this. People do not connect the dinner plate to the eye symptoms they have the next morning. They connect screens to the eyes. They connect allergies to the eyes. They connect aging to the eyes. But the orange at 10:15? The tomato sauce at 9:30? The healthy bedtime snack that bought them a rough night of sleep and a dry, inflamed ocular surface by sunrise? That connection almost nobody makes. So today, 2 foods, 1 fruit, 1 vegetable. One of them is famous for being healthy. The other is hiding in 1,000 light dinners people eat every week without a second thought. And both of them can work against healthy eyes at bedtime for exactly the same reason. Before the list, one idea. If you understand this, you can work out the answer for almost any nighttime food in your own kitchen. Your eyes need 3 things from sleep. They need moisture, stability, and recovery. Moisture because dry eye is not just not enough tears. The American Academy of Ophthalmology describes dry eye as a problem of too few tears, the wrong kind of tears, or tears that evaporate too quickly. Stability because the tear film is not decoration. It is the optical surface. If it breaks up too fast, vision gets smeary, reading gets annoying, and the eye starts throwing off distress signals. Burning, grittiness, redness, reflex tearing, the whole miserable package. And recovery because the eye is living tissue. It inflames, it dehydrates, it gets irritated, and sleep is one of the main times your body gets to put that down and repair it. Now here is where the kitchen enters the eye. There are 3 routes from a bedtime food to tomorrow morning's eye symptoms. 1, it triggers reflux. You lie down, stomach contents move upward, sleep gets lighter, the throat gets irritated. Sometimes the mouth opens. Sometimes you do not even register full heartburn. You just have a rough, broken night. The NHS guidance is blunt about this. Reflux symptoms are often worse after eating and when lying down, and people are told not to eat within 3 or 4 hours before bed. That is not because the stomach is being dramatic. It is because gravity mattered more than people wanted it to. 2, it fragments sleep. And this is where people underestimate the damage. You do not need to be fully awake at 2 a.m. staring at the ceiling for food to interfere with sleep. A few extra awakenings, delayed sleep onset, shallower sleep, more tossing, a little more mouth breathing, a little more dryness in the room and in the eye, that is enough. In an experimental study, even a single night of sleep deprivation in healthy adults increased tear osmolarity, shortened tear breakup time, and reduced tear secretion by the next day. Same eyes, one bad night, different surface. 3. It worsens the metabolic environment that your eyes live in. Over years, high blood sugar is toxic to the retina. The National Eye Institute is crystal clear on that. Too much sugar in the blood damages the retina's tiny blood vessels over time. And separate sleep research has shown something clinicians have been trying to explain to patients forever. Bad sleep and late timing do not stay in the bedroom. They show up in glucose control. Later bedtime routines and poorer sleep efficiency are associated with worse blood sugar responses the next morning. Which means the healthy sweet drink or sweet bedtime snack you use to end the day can hit you twice. First by disrupting sleep, then by worsening the metabolic conditions that retinal tissue hates over the long haul. So, 3 roots. Triggers reflux, fragments sleep, worsens the overnight setup your eyes depend on. And the important thing is that none of this requires the food to be junk. A food can be healthy at noon and badly timed at night. That is the whole story. All right. Number 1, and for most people this is the worst fruit before bed for healthy eyes: oranges. And with them, the whole citrus family: grapefruit, tangerines, clementines, orange juice, lemon-heavy fruit bowls, the lot. I'll say the good part first because it's true and it matters. Citrus is not the enemy. The Academy talks about vitamin C as critical to eye health. Citrus fruits are one of the classic dietary sources. Antioxidants help protect tissue from oxidative damage, and diets rich in fruits and vegetables are part of the same pattern we recommend for the rest of the body anyway. So if you heard oranges are good for the eyes, that sentence was not wrong. What was missing from that sentence was the clock. Citrus is acidic, and acidic foods are some of the most common trigger foods in reflux guidance. Not for everybody, but for enough people that every clinician who deals with reflux sees the pattern over and over again. The NHS lists tomatoes, spicy foods, fatty foods, coffee, chocolate, alcohol, all the usual suspects, and clinical guidance commonly includes citrus juice among the triggers people should watch. The problem is not that the orange damages the eye directly. The problem is that you eat it or drink it, and then you lie flat. And when you lie flat, the body loses the help of gravity. A short dinner-to-bed interval has been associated with a much higher likelihood of reflux. In one case-control study, people who went to bed within 3 hours of dinner had a dramatically higher odds ratio for GERD compared with people who left 4 hours or more. That is the kind of number that should make you stop pretending your light little healthy snack at 10 p.m. is nutritionally invisible. Now let me make this more practical, because reflux is not always the cartoon version. People think reflux means flames in the chest. Sometimes it does. Sometimes it is textbook heartburn and a sour taste. But a lot of the time, especially at night, it is quieter than that. Throat clearing in the morning, hoarseness, a cough, a feeling like sleep just was not deep, restless waking, dry mouth. And if you are prone to dry eye already, that rough night lands right on tissue that is already irritable. And here is the part most people miss. Dry eye and sleep have a two-way relationship. People with dry eye sleep worse, and poor sleep can worsen dry eye. A 2024 meta-analysis pooling 21 studies and more than 419,000 participants found that dry eye was associated with worse sleep quality, longer sleep latency, and a higher risk of sleep problems overall. Now, I want to be scientifically honest here. Association is not the same thing as proof of a one-way cause. The relationship is complicated, but the direction that matters to you tonight is simple enough. If a bedtime food makes your sleep worse, your eyes are not going to thank you for it in the morning. So score orange, not as a bad fruit, as a badly timed fruit. Does it trigger reflux? In a lot of people, yes. Does that fragment sleep? Very often, yes. Can that leave the ocular surface drier and more unstable by morning? Absolutely. And there is a second reason orange moves higher on my list than most people expect. Juice. The whole orange is one thing, the glass is another. When people say, "I just had something small," what they often mean is they drank their fruit. Orange juice before bed looks innocent. It looks clean. It looks better than ice cream, and sometimes it is. But juice removes the slowing effect of the intact food structure. It becomes very easy to take in more sugar, faster, with less satiety, in a form that is also acidic and reflux-prone. If you have pre-diabetes, diabetes, central weight gain, or you already know your blood sugar runs high, late juice is one of those habits people defend with surprising emotion because they think fruit cancels out timing. It does not. And eye tissue cares about that. The retina is packed with tiny blood vessels. High blood sugar over time injures them. The National Eye Institute and the Academy are both unambiguous about the basic mechanism. Elevated blood sugar damages retinal vessels and threatens vision. So no, one nighttime glass of orange juice is not giving you retinopathy. That would be silly. But years of poor metabolic habits, plus bad sleep, plus nightly choices that keep glucose higher and sleep rougher than it needs to be? That is exactly how long-term risk actually accumulates in real human bodies. Quietly, repeatedly, without fireworks. The fix is free. If you like citrus, eat it earlier. Breakfast, lunch, afternoon, fine. If you are prone to reflux, do not use citrus as your bedtime virtue signal. And if what you really want at night is something sweet, do not drink the fruit. That is the move to stop, especially after dinner, especially if you have heartburn, a chronic cough, hoarseness, morning throat irritation, dry mouth, watery eyes on waking, or the very common sentence I hear in clinic, "My eyes burn in the morning but get a little better as the day goes on." Quick pause, because we're about halfway and this is the only favor I'll ask. If you would rather have the mechanism than another recycled list of 10 miracle foods, subscribe. And send this to the person in your family who says, "But it's healthy," while standing over the fridge at 10:30 at night. That is the person I'm talking to. All right, number 2. The worst vegetable to eat before bed for healthy eyes. And I'm putting vegetable in the way people use it in the kitchen, not the way a botanist would argue with me in the comments. Tomato. And with it, tomato sauce, marinara, pizza sauce, salsa, ketchup by the spoonful on leftovers. The concentrated red base hiding in the dinner people swear was not heavy. Again, the good part first. Tomatoes are not nutritional villains. They bring vitamin C, they bring carotenoids. They fit beautifully into an overall healthy diet. This is not an anti-tomato sermon. In fact, that is exactly why they fool people. Tomato-based meals carry a health halo. Pasta with tomato sauce feels lighter than cream sauce. Tomato soup feels gentle. Salsa feels fresh. Roasted tomatoes feel Mediterranean and responsible. And all of that may be true at 1 o'clock in the afternoon. At 9:30 at night, tomato becomes a different conversation. Tomatoes are acidic. They are one of the classic trigger foods in reflux guidance. The NHS explicitly mentions them. Pediatric and adult reflux guidance alike repeatedly flag acidic foods, tomato among them, as common offenders. And tomato is sneaky because people rarely eat it alone at night. They eat it concentrated, cooked down, and paired with other things that magnify the problem. Garlic, onion, black pepper, chili, cheese, sausage, oil, a big portion, and then a short walk directly to the bed. So the tomato problem is not just tomato. It is the whole delivery system. A few raw tomato slices at lunch are not what I worry about. The real problem is the bowl of reheated pasta in red sauce at 10 o'clock, the second piece of pizza an hour before sleep, the spicy tomato soup after a long day because you could not be bothered to cook anything else. The jarred sauce with a little sugar in it that you keep telling yourself is still basically a vegetable. That combination is built to do one thing beautifully: bother the sleeping body. And when the sleeping body is bothered, the eyes collect the bill. A lot of morning eye complaints are actually overnight environment complaints in disguise. The person says, "My eyes feel sandy," or "They water as soon as I wake up," or "I have to blink a few times to clear them," or "I can't wear contacts comfortably until later." They blame pollen, age, the ceiling fan, the phone, the season, all reasonable suspects. But if you ask enough questions, another pattern shows up: late dinner, tomato-heavy food, reflux, bad sleep, dry mouth, waking at 3 o'clock. Then the eyes. Remember what the Academy says dry eye can look like: burning, blurred vision, irritation, a gritty sensation, redness, even excessive tearing. That last one confuses people every single time. They think, "My eyes can't be dry, they water." They absolutely can. Reflex tearing is what irritated eyes do. The surface gets unstable, the eye gets annoyed, and it overreacts. Now let me add a layer people do not love hearing, but it matters. Sleep quality affects more than comfort. It affects how you manage the rest of your metabolism. Review data on sleep, diet, and glucose control suggest that late eating and nighttime glucose excursions can go along with more sleep fragmentation, and later bedtimes and poorer sleep efficiency are associated with worse blood sugar responses the next morning. So the late tomato meal is not just a reflux issue. It is often part of a bigger nighttime pattern: large meal, late hour, maybe dessert, maybe scrolling, maybe a short night. That pattern is hostile to the eyes in slow motion. And this is where someone always says, "Doctor, are you really telling me tomatoes are worse than cookies?" No, I'm telling you timing changes the ranking. At 2 o'clock in the afternoon, tomatoes are not a problem for most people. At 10 o'clock at night, for a person prone to reflux, mouth breathing, dry eye, or poor sleep, tomato may be far more relevant to tomorrow morning's eyes than a lot of foods you have been taught to fear. Score tomato. Does it trigger reflux? Often, yes. Does the way people actually eat it at night make that worse? Very often, yes. Does that interrupt the sleep your tear film and ocular surface depend on? Yes. And unlike a bedtime tomato that gets eaten alone, tomato sauce usually arrives in a portion that is too big and too close to bed. That matters. Large meals themselves are part of reflux guidance. So tomato is not just chemically acidic. It is behaviorally paired with late-night habits that are almost custom designed to punish sleep. Let me tell you about a patient, because this becomes real the second you put a human being in it. A man I'll call Victor, 61, came in convinced he had developed an eye allergy that only happened in the morning. Red lids, burning, watering, vision filmy for the first hour. He had already bought 3 different drops on his own, wanted me to recommend the stronger one. So I asked the boring questions nobody likes because they think they are unrelated. What time is dinner? What do you eat late? Do you wake with a sour taste? Does your throat need clearing in the morning? Do you snore? Do you ever sleep with your mouth open? Long pause. Turns out his standard routine 5 nights a week was late pasta with red sauce after work, sometimes pizza, sometimes tomato soup and toast. In bed within an hour and a half. And yes, now that I mention it, doctor, my throat is rough in the morning. And yes, I do wake up dry. And yes, my wife says I cough in my sleep sometimes. Victor did not need a fancier eye drop nearly as much as he needed to stop treating the hour before bed like a nutritional loophole. We changed 3 things. Tomato-heavy dinners earlier. No food inside 3 hours of bed if he could help it. Smaller portions when the evening did run late. We also worked on sleep position and a couple of other dry eye basics. His eyes were not cured by avoiding tomatoes because medicine is rarely that childish, but the morning burning settled down enough that he could tell the difference himself inside weeks. The useful question was never, are tomatoes bad? The useful question was, What are tomatoes doing at that hour in that body? That is almost always the right question in nutrition. Now, the sentence I want you to remember from this whole video is this. The best eye supplement in this story is time. Not a gummy, not a powdered greens mix, not a blueberry capsule with a heroic label. Time. 3 hours, ideally, between the end of your last real meal and lying flat, especially if you know you are reflux prone. That one change does more for a lot of nighttime eye irritation than people expect, because it fixes the actual bottleneck, which is not a vitamin deficiency. It is a sleep quality problem, disguised as a food problem. And I want to be fair, not everyone reacts to citrus, not everyone reacts to tomatoes. Some of you can eat salsa at midnight and sleep like a stone. I know. You'll tell me in the comments. Wonderful. This video is not about you. It is about the enormous number of people who have normal-looking diets, unexplained morning eye misery, and no idea the plate and the pillow are talking to each other. Before the recap, one hard line, because everything I've talked about today is the slow version of this. If you have persistent dry eye symptoms affecting reading or daily activities, recurrent morning burning, worsening redness, new light sensitivity, significant pain, sudden vision changes, flashes, floaters, or a curtain over the vision, do not sit there experimenting with tomatoes for 3 weeks and calling that medical care. See an eye doctor. And if you have heartburn most days, chronic cough, hoarseness, trouble swallowing, or you are living on antacids to get through the week, that deserves proper evaluation too. All right, what to do tonight? 5 things, and every one of them is free. 1. The worst fruit before bed for healthy eyes is orange, especially as juice, and with it the rest of the acidic citrus family. Not because citrus is unhealthy, because acidic fruit too close to lying down can trigger reflux, fragment sleep, and leave the eyes drier by morning. 2. The worst vegetable before bed for healthy eyes is tomato, especially concentrated tomato sauce in a large late meal. Again, not because tomato is a bad food, because at night it is one of the most common reflux triggers people keep mistaking for a health food pass. 3. If you struggle with morning dry, burning, watery, gritty, blurry eyes, stop thinking only about eye drops. Ask what happened in the 4 hours before bed. The eye symptom may be real, but the trigger may be downstairs in the kitchen. 4. Leave a bigger gap between dinner and the pillow. 3 hours is a good target if reflux is part of your story. Even moving in the right direction helps. 5. If you want fruit or vegetables for your eyes, keep them in your day. Eat the orange at lunch. Put the tomatoes in a midday salad. Use the produce for the nutrition and stop using it as a bedtime alibi. Because that is the twist in this whole thing. The foods people praise for eye health can work against eye comfort when the timing is wrong. Good food, wrong hour. That is all. And once you see it, you start noticing it everywhere. If this is the kind of thing you want more of, honest explanations of what is actually happening inside you, and not just another dramatic headline, hit subscribe, give this one a like, and tell me in the comments which one surprised you more, the orange or the tomato. I read them. I'm Dr. Naturis. Look after yourself, and I'll see you soon.